Hey there, welcome. It's Dr. Barbara Woods with the Intergenerational Trauma Therapist Show. And today we're going to talk about creating felt safety for children and adolescents. We're working this month on developmental trauma and understanding that at a much deeper level. So, felt safety is a very cornerstone and key piece of this puzzle in the context of intergenerational trauma. So, felt safety is basically the individual subjective experience. So it's the individual's experience of feeling safe on all levels. So they feel safe emotionally, physically, and in the autonomic nervous system. It can help, this felt safety can help minimize the impacts of intergenerational trauma on development. And this is done through attunement and co regulation. So, what we're going to cover today is we're going to look at understanding felt safety, the foundations to foster this felt safety and to create it for kids and adolescents, and ways to enhance felt safety. So, ways to deepen that, particularly for kids who have experienced trauma. They require that deepening, a deep felt safety to move through and heal from the impacts of trauma. And then we're going to look at special considerations related to developmental stages because it changes and shifts in what helps promote safety for young children, school age children, and then adolescents. So we're going to start with figuring out what felt safety is and understanding it a little bit better. So again, it's that individual subjective experience of the psychological, emotional, physical, and the nervous system. So safety is really the balance of the autonomic nervous system, and it's anchored of those states in the autonomic nervous system, and it's anchored in social engagement and relationships. So greater safety experiences over time, when we have multiple experiences of feeling safe in relationship, in our environment, within ourselves, we end up having a wider window of tolerance and more autonomic resilience. So what that means is a wider window of tolerance. We can tolerate more stressful things. Things don't cause us to become reactive quickly. We don't shut down as quickly. We can handle more difficulties without those extreme or more powerful reactions. And it's easier once we do come out of our window of tolerance, it's easier to get back into that window of tolerance because of that autonomic resilience and flexibility. So safety, especially felt safety and deep felt safety, are a relational experience. It happens in the context of a relationship. So when we neurocept danger, interaction with another person or mammal can help us feel safe again. And there's a reason I've used the mammal because some of the kids that I work with have had such complicated relationships that it's nearly impossible for them to feel safe with an adult or with another person because they've grown up in environments where that just it doesn't serve them to drop their guard and feel safe because the environment hasn't been safe. My number one co-regulator in sessions is my therapy dog, and he can get past that. He can get them to giggle and to laugh and be affectionate. They can accept affection from him. So it's really important to understand that it can be a mammal, it can be a dog, a cat that has a similar type nervous system for that co-regulation. We don't want them to stay with only being co-regulated with mammals or their pets. We want them to be able to develop this with people as well. So that's where some animal assisted therapy can be so useful in developing this deep felt safety for kids and adolescents and adults too. So when we experience alarm or terror, this is the neuroception of danger. Another person's interaction with us can help us return to safety. So we look at things like tone of voice, the prosody of their voice, that it's not just monotone and kind of the same across the board, there's kind of an element of up and down in their voice that helps them to communicate safety to the other person's nervous system. There's also kind of a softness to the eyes. Their heartbeat and heart rate becomes important, and not that we can hear it, but it's important in their presentation and our neuroception at our nervous system level of where they're at as far as safety, danger, and threat. So this really comes down to the concept that Daniel Siegel calls MWE, and that's MWE. And that is a blending of me in a relationship, so that's the we, and the context or environment. So some people refer to this as inside, outside with the environment, and between two people or people. So children and adolescents' experience of felt safety is totally rooted in relationships and attachment. So kids with impacted by intergenerational trauma can have significant difficulties with felt safety because their parents likely have difficulties with felt safety as well. So relational harmony with other people is a huge component of felt safety, and it's even deeper for kids who have been impacted by trauma, specifically intergenerational trauma. So when there's significant attachment disturbances, these create huge difficulties in experiencing felt safety because that whole system of attachment has been impacted in a negative way. And sometimes the attachment strategies that kids start to use actually kind of prevent felt safety to occur because they get very defensive, they trigger an adult or caregiver, and then the adult or caregiver becomes alarmed and triggered, and nobody can kind of calm it down. So when relationships have been alarming, terrifying, or not good enough, so they haven't met the basic needs of a child or mainly an infant, at meeting those basic attachment needs, those insecure attachment strategies will develop because it's a natural striving for relationships. So you'll find those classic ones of anxious, kind of high pursuit, clingy, needing to be around the caregiver, know what the caregiver is doing, not able to tolerate separation. You'll have avoidant, which is kind of shut down and they're just kind of there, but they don't look to connect, and they may be difficult to connect to, but their nervous system is still looking for someone to connect to. And those disorganized strategies, and disorganized really isn't a good word for it because they're actually organized, they're just very conflictual. So you'll see a pursuit, and then when somebody tries to support them, encourage them, offer safety, they attack because it doesn't feel safe. Those are kids who have been around caregivers, parents, or adults who are either scary or they're very scared, and the child has to step in to create safety. So some of the children that we see have had very complicated relationships with adults. They just have not had good experiences to experience that felt safety. And an animal in a like animal assisted therapy may be their first initial source of felt safety. And if the therapist is there supporting the child to connect with that animal, the therapist kind of becomes triangulated in a positive way in that felt safety. So now we're going to look at the impact on development when there is felt safety on brain development and regulation. We're going to look at those impacts. So when there's an absence of felt safety and significant experiences of alarm or terror, really scary things, really scary adults and relationships, and there's no co-regulation, so there's no adult or other person there to calm or soothe or connect or attune with the child, they don't have resources for self-regulation. So that's how we learn self-regulation, is through those co-regulation in relationships when there's been some kind of alarm, terror, or something happens that is pushes the child out of their window of tolerance. The ultimate outcome of these disruptions and in these developmental areas, and unfortunately, these disruptions can create further difficulties with felt safety and attachment. So it's kind of like a synergistic negative effect that they don't have felt safety, they don't have co-regulation, they can't connect with adults, and then their development is impacted, and those developmental impacts make it even harder to connect with them for adults and to co-regulate and attune with them. So we really need to be aware of these developmental impacts, and I feel like I go over these all the time, but they're so important to recognize and understand how they fit into this picture. So we already talked about attachment. That's the first domain that's impacted. These are those increased strategies that are anxious, avoidant, or disorganized. It impacts biological development. So you'll see from that chronic alarm state where they don't get that rest and digest time in that state, you can find lower muscle tension. They can have sensory difficulties and autoimmune conditions. So a child with a lot of sensory difficulties may be hard to co-regulate if you're not aware that it's the sensory input or processing that is difficult for them. If you're not attuned to that, it's going to be hard to help them have that felt safety. The next area is in affect or emotion regulation. So when they don't have that felt safety and that co-regulation with a caregiver, they miss out on the reflection and validation of their autonomic states and their emotions that come out of those autonomic states. So there can be huge difficulties. They may not even recognize emotions because they haven't had somebody say to them, "Oh my gosh, you're scared," or "You're upset." They may have had somebody just say, "Knock it off," and they don't understand the labels and they can't recognize their emotions. And they can't regulate those emotional states as a result. So this creates a very narrow window of tolerance. Lots of things cause distress and dysregulation with a narrow window of tolerance. And there can be inflexibility or lack of resilience. So once they get pushed outside of their window of tolerance, it's going to be hard for them to get back in because it's very narrow and there's a lot of inflexibility in their system. But this is all for survival. So it's not something we totally want to get rid of. We just want to widen that window of tolerance and create some flexibility and resilience in their autonomic nervous system. So the next area is children with developmental trauma typically have more dissociation. So there will be significant gaps in their experience. They'll numb out to decrease their degree of alarm or terror. So this creates further difficulties in those experiences with a caregiver. They can't remember the co-regulation or can't remember the sense of felt safety. They can't recall it. Their body will recall it, but their psychological or their mind won't recall it. Impacts their neuroception. They may have very dampened neuroception where they don't detect danger anymore. So they're exposed to more and more difficulties and dangerous things that they may not have been had they had that co-regulation. And they kind of just check out in relationships and are hard to connect with. The next area that we look at is behavioral control. So this has to do with impulsivity, self-destructive behaviors and coping mechanisms, sometimes very oppositional behavior or sometimes very over-compliant behavior. So they may have difficulties with rules and they may also repeat the trauma behaviorally. So their play may be a repetition of something about the trauma that they've experienced. So these behavioral difficulties are really hard for adults who aren't aware of these impacts, how to co-regulate, how to attune. It makes it very hard for them to connect with a child that is experiencing this. And then it's hard for them to not have their own reaction and become harsher with punishment or greater expectations or no flexibility with any kind of behavior, because the adult's triggered too. So this is an example of co-dysregulation where the impacts on the child cause the dysregulation of the adult because they're not aware usually of what is happening and how these impacts kind of affect relationships. The next area is cognition. There's some difficulties with information processing because if the child is in a constant state of alarm, their brain is more focused on survival than learning language, than computing math facts. So you can have information processing difficulties, learning disabilities. They can have difficulties planning out what they need to do kind of in a sequence to get where they want to go. They'll have difficulties with responsibility. So when something happens, they either won't take responsibility. Sometimes they'll take too much responsibility. And if they have a lot of shame and they're impacted in that way, they may take too much responsibility. So the last area that we look at is their self-concept. And so they can have difficulties with self-esteem, an independent sense of self. So they may change and shift based on who they're talking to. So if they're talking to a teacher, they may say, I want to be a teacher when I grow up. And if they're talking to a fireman, they're going to want to be a fireman when they grow up because they're going to be like whoever they're around because they don't have a stable sense of self. And that can lead to inconsistencies in relationship and inconsistencies in their self-concept. So they may not have a lot of awareness of who they are and what they're really about. They also may have that excessive shame and guilt. So this is a really important aspect of looking at this, the developmental impacts of intergenerational trauma, developmental trauma on children, because they typically have a lot of shame and guilt that underlays all their behavior and everything that they experience. So now we're going to contrast felt safety with just physical safety. So felt safety is perceived psychologically. So we interpret it, we think about it. It's a psychological experience, but it's also experienced physically. So without both the psychological perception and the physical experience, there isn't deep safety. It has to be in both of those areas. If we only have psychological safety, it may override the alarm system, which can lead to faulty neuroception. So it can be dampened and non-reactive. I've seen kids that have walked through dangerous situations without a care in the world. They'll pick something up and read it, and they won't even be fazed about what's going on around them because they don't have that internal experience, that physical experience of a lack of safety, or their neuroception is very dampened. So they can't detect danger. One area that we can see this a lot is when a child has experienced abuse that has included grooming. So this contorts their sense of safety, and they may perceive safety where there is not safety, or they may neurocept safety where there is not safety. If we only have the physical safety in our autonomic nervous system, we can have constant psychological experience of danger and threat, and this can also lead to faulty neuroception. So they can detect danger when a threat really isn't present. So excessive neuroception of danger and threat, it sensitizes the nervous system to more danger and threat. So you'll find some behavioral difficulties. You can find relational disturbances with peers. You can find they're very defensive in relationships. So that is where we need both that psychological experience and the physical experience. So insecure attachment strategies may increase attempts to find that felt safety in relationships. That's what they're really looking for and what their nervous system is pushing or driving their behavior toward. So in anxious attachment strategies, that's a pursuit to be close to a safe base. So they try and try and try, but it's usually difficult for the adult to reassure or to give them that sense of felt safety. And avoidant attachment strategies, they just kind of shut down to prevent further fear, but their attachment system is always scanning for relationships. So there's a little bit of a conflict there between the shutdown and not seeking it out or avoiding it with the biological drive to attach. With disorganized attachment strategies, there's usually some degree of emotional fear in relationships. They may not verbalize it, but you'll see it in their behavior. And this causes defensive behavior, but they also pursue. So they'll pursue like anxious strategies and they'll want to be close to somebody. They'll want their attention. They'll need them. But then when they turn around and say, I'm here, or you offer felt safety, it triggers terror and they can attack or become very defensive. So that's where that's where the label disorganized comes from, but it's really not disorganized. It's a complex mixture of both anxious and avoidant strategies. So that brings us down to that relational harmony is a huge component of felt safety. So that harmony in relationships is really the foundation of felt safety. So now we're going to look more at the foundations of felt safety. So felt safety over time, it creates and develops attachment. Attachment supports continue to help the person feel felt safety. So it's kind of like a synergistic cycle where felt safety helps them attach, and then that attachment helps them experience more felt safety. So it just builds and grows. In the context of intergenerational trauma, felt safety really has to begin with the caregiver's awareness of their own autonomic nervous system states and felt safety. So if a caregiver hasn't experienced their own sense of felt safety, they can't give it to the child because they don't know what it is. They don't know what it feels like. And they're also likely going to be misattuned to behavior because of their own dysregulation. So they aren't able to provide that felt safety for their children. So the first step is really having the caregiver have self-attunement to where they're at and awareness of their autonomic responses and regulation, so that they're aware when their child triggers their autonomic nervous system to go into fight or flight or become defensive, they recognize that, okay, this just happened. I'm attuned to myself. I know what's happened inside myself in the context of the parent-child relationship and in the environment. So they have a lot more self-awareness and attunement. And without this, the parent, they can't attune and they can't co-regulate. So if they're not aware of their own reactivity, their own responses, that own relational harmony or disharmony, they are not able to understand that the child is having a reaction because something just scared them, and their nervous system took it as a threat or danger. So they won't do things to co-regulate. They may not have the skills or know how to do that. And what happens is they end up having greater difficulties with negative mentalizations of the child. So the child's doing this on purpose, or they're controlling, or they're too demanding, or they're a bad child, or all those negative concepts of the child, because that child doesn't have felt safety. So that can create even more difficulties with attunement and co-regulation if you're looking through a lens of very negative mentalization of the child. So caregiver self-attunement is the first step. Attunement to the child is the next step. So the child needs to be seen, heard, and understood. So the context of the child having a defensive reaction needs to be understood, that something scared them, and they're not a bad kid. They're not controlling. They are under a threat, and they may be neurocepting this as a life threat. So after there's attunement to the child and what the child may be experiencing, we move into co-regulation. That's the third step. In co-regulation, a caregiver can provide those conditions for experiencing felt safety. So they end up co-regulating in helping the fear to go away or helping the nervous system to calm, helping them get back in their window of tolerance, which creates more autonomic resilience and a wider window of tolerance. So, a note about co-regulation that some people may not expect is that some children who are impacted by trauma, they are masters at co-dysregulating adults. They have got this skill down to a T, and it's not because they're bad or controlling. That's the negative mentalization. It's because they've had to do this to survive in the past. So we have to consider this when they trigger adults or when there's this co-dysregulation that happens. This is a way that they communicate their internal pain and experience to adults by evoking the same terror and fear in that adult. The problem is we usually don't recognize it as that, and we start to clamp down on their behavior, which causes more, that is not going to create a sense of felt safety. So out of the caregiver self-attunement, attunement to the child, co-regulation, the next step is that felt safety. It's a deep, deep sense of safety in a relationship that's based on that attunement and co-regulation. It means to the child, that adult sees me, they know what I'm going through, they understand me, and they help me make it better. So that is what they help me return to safety. So that is that experience of felt safety and where it comes from. And what that helps the child do is then they have their own self-attunement. So they can develop greater awareness of their self and their responses. Their window of tolerance is wider, so they may be able to tolerate more difficult things and not be triggered really quickly or not have a neuroception of danger in all circumstances where it's faulty neuroception. And so this greater awareness of their self, their responses, the wider window of tolerance, the greater autonomic resilience, this helps them develop positive self-beliefs. So this helps them to start thinking, oh, I can do this. I got this. I made it through that. I do have some good qualities or strengths. So they'll actually end up turning the tide on some of their own negative self-mentalization. And if you go back and listen to or look at what we just talked about, this is exactly where the 5 domains of assessment checklist came from. So it includes the impacts on therapy as well, because that's the parent's difficulty, usually with felt safety. So if you connect really well with their child, you have a great experience, the child's laughing, it's really relaxed, that can trigger the parent because they've never felt that. And it may cause them to feel like they're inadequate or that you're undermining them. So we have to be aware of those difficulties with the impacts that intergenerational trauma can have on the therapy process itself. We also look at the problems with co-regulation, parenting strategies that backfire because of the problems with co-regulation, and that negative mentalization of the child. And we also want to look at the negative self-beliefs of the child to see how far has this impacted and how deeply rooted is it in the child level. So these domains specifically consider the parent's felt safety and co-regulation skills that may cause difficulties with parenting strategies and their mentalization of the child. And it also considers the impacts on the child's self-belief. So that's the map that we look at to assess where a parent-child interaction is at when we're working with intergenerational trauma. So now we're going to look at strategies to foster felt safety. So we're looking at creating a safe environment in the context of intergenerational trauma. So intergenerational trauma creates a totally different clinical picture than single incident trauma. Single incident trauma will likely stress the parent-child relationship. It will cause dysregulation, but not at the deep level, usually where it impacts attachment, unless the single incident trauma is extreme. We usually don't see those deeper impacts and kind of the wide range of impacts with single incident trauma. So there's a few concepts that we're going to look at. The first one is that felt safety, it has to begin with the caregiver or parent. The foundation for felt safety for the child is rooted in their parents' experience or their parents' ability to have their own sense of felt safety. So if the parent hasn't ever experienced felt safety, they don't have an internal working model of how this works, or a compass, or a relational detection system with their child. They just have their own reactivity and they don't ever feel safe themselves. So if the parent has unresolved complex trauma from their own childhood that has not been treated, they'll struggle with attunement and co-regulation. It just interferes with it, and it's not because they're not skilled or they're not good, or they'll never be a good parent. It's because they haven't had those experiences, and they've had experiences that have been hurtful, that have created these defensive reactions in them. So eventually, when they struggle with that difficulties with attunement and co-regulation, eventually they'll have negative mentalization of the child, because they're not picking up on how to kind of shift this and how to co-regulate so that the child doesn't have the defensive or shutdown reactions. So this is where including the caregiver or the parent in the therapy process and providing them with an experience of felt safety is that necessary foundation for treating intergenerational trauma. So if the therapist can provide attunement and co-regulation for the parent's experience, that is where they learn and they have a different experience that they can then carry into their relationship with their child. The difficulty is intergenerational trauma is very complex and it presents differently when you're working with it and when you're working with a child. So you can't apply strategies from just trauma interventions into this situation. If we don't have that specialized training in intergenerational trauma therapy, we may not effectively attune with the parent, because we might think like, well, why did they throw away their little safe space that we made as a craft in therapy, because they didn't think it was a big deal. Well, it's because they don't recognize the importance of safety. They may not have felt it. They don't get that their behavior of throwing this little craft away has shattered their child's experience of felt safety, of creating that safe space for a little animal or little creature that they put into that. That's a therapy exercise that we do frequently. So if we don't have that specialized training in intergenerational trauma therapy, we aren't going to be able to specifically attune to parents who have intergenerational trauma, because it's very different when there's years and generations of difficulties with attunement, co-regulation, and felt safety. So what happens is if we don't have that training, we don't know the intricacies of their experience to be able to effectively attune, and then there's no co-regulation. Excuse me. Concept 2 is attunement and co-regulation with the parent that creates the foundation of them to experience and effectively attune with their child and to co-regulate their child. So we're working with the parents' unresolved trauma to give them a different relational experience of felt safety and to build a bridge with their child in order to create greater relational harmony between them, in order to create better interactions, better attachment strategies. That's what we're ultimately working towards. So that's the attunement and co-regulation with the parent that creates the foundation for them to experience and effectively attune and co-regulate their child. Concept 3 are those co-regulation experiences for the child. When parents have that felt experience of co-regulation and deep safety, they're primed to co-regulate their child. They've had that experience. They know what it feels like. It will tap into their biological drive to attach to their child, and it creates a whole different way of interacting and being with their child. So, strategies to support their awareness of child development and trauma informed understanding behavior is really critical because it supports their ability to understand, to recognize, to attune to the child, and to co regulate at the child's current level. And then concept 4 is that felt experience of deep safety for the child. So that's your felt safety or felt deep safety. So over many experiences of co-regulation, the child starts to experience that deeper sense of felt safety. It increases accurate neuroception, which alleviates so many of the impacts of intergenerational trauma. So when they have accurate neuroception, they're less likely to have difficult behavioral impulses. They're more primed for attachment. Their emotion regulation is better. So it helps to push back on those developmental impacts of intergenerational trauma or that developmental trauma. So eventually the child will have improved self-regulation after they have a lot of these experiences of co-regulation. They'll have that widened window of tolerance and increased autonomic resilience. So they're more able to tolerate pressure on the boundaries of their window of tolerance or their range of coping. And they'll have greater autonomic resilience so that they don't get stuck in either a defensive or shutdown response. So the developmental impacts of intergenerational trauma are then impacted. They're pushed back, they're halted, which stops further impacts because these impacts are kind of like a vicious cycle. These impacts cause more difficulties with attunement, co-regulation, and felt safety. But if we can kind of stop some of those developmental impacts, it'll stop that cycle from getting worse. It most likely improves many of the impacts. They may require further intervention for specific difficulties like sensory learning, language, those kinds of things that sometimes we have to work with other professionals to help deal with those areas, which is really important to kind of keep that in the back of your mind every time you're working with one of these kids, because they have really complex needs, and addressing all of those domains of development that are impacted will get so much more impact for that child. So concept 5 is that the transmission of intergenerational trauma at this point, when that child has greater autonomic resilience, wider window of tolerance, the developmental impacts are stopped or impacted and pushed back, it can stop the cycle of transmitting intergenerational trauma. So when the parent's unresolved complex trauma is treated, the developmental impacts of intergenerational trauma on the child are both addressed, both the parent and the child, it's less likely to continue to future generations, which is exactly what we want. Excuse me. So now we're going to look at special considerations for different age groups. We're going to start with our youngsters from 0 to 6. Foundational years of attachment and felt safety are really 0 to 3. Excuse me. This is a period of time where that felt safety is really strongly laid down and can be laid down for life. So we want to be really aware of these years and what may have happened for a child during this time. It's normal for children of this age from 0 to 6 to have regression when they've experienced terror, fear, or trauma. It's really normal for them to kind of become whiny, clingy, become much less where they're developmentally at. So they may act like they're like 3 years old again. But we just have to return to the basics. of self-attunement, attunement to the child, co-regulation, and attachment strategies. But that's very normal. It's actually, I've read that it's actually a sign of resilience, that the nervous system is adjusting to where their developmental needs are at, and their skills will kind of become stronger as they move forward. We also, during this time, we want to be very aware of their brain state and development related to negative self-beliefs. So between ages of 5 to about 7 or 8, this is the foundation of where negative self-beliefs become a driving force later in life. So this is a time where their brain cannot fact check, and their brain is in like a theta state, which is very open to suggestion. So that's where Santa Claus is really amazing, and the Easter Bunny and all those magical kind of things. That's why they're magical, because they don't fact check. So this applies to negative self-belief. So if they have an experience between 5, 7 to 8, and they think, oh, I'm a bad kid, I really did, nobody likes me, I'm not loved, that will become a driving force later in life, and it will significantly impact the child. So these negative beliefs, they become automatic, and they perpetuate the transmission of intergenerational trauma. That's why they're in that 5 domains checklist, and why it's very important to remain aware of these impacts. Now we'll look at school-aged children from 7 to 12. So these are some of your tween years. So this is where school becomes a very important part of their life. And this is where we want to include teachers, staff, and school-based strategies to increase felt safety. For some kids, their teacher or a school staff member may be their first experience of felt safety. So these people in these roles are so important to these kids. And if they can learn these skills, they're usually fairly good at using these skills. They can really make a change for these kids. And one of the things that I have noticed in my practice is we work with some agencies that they'll hire a driver to transport the child to therapy, because the parent may be home with a number of other young siblings, or they may be in a foster placement where the foster parents work. So there's all these reasons why they hire a driver, and they usually come from a farther distance, maybe like an hour away. And that driver can have a monumental impact on the child by helping them just have a really good experience and feel cared about, and taken to therapy. And then after therapy, sometimes they get, with teenagers, they usually get an ice cap. With kids, they usually get something to eat, something to kind of soothe them as they go back to their home. And there was one driver that created felt safety for everybody. Whenever he came in the office, he's very polite, kind. How are you? How's your day? And really connected with people really well. And the kids that were transported by him, they did really well in therapy, because he created this container of, I'm with you as we go, you'll have your therapy, and I'm with you when you leave, and I'll do things to support you. You'll feel safe. And that was such an impactful person that you may not realize how impactful you may be in some of these children's lives. So consideration at this age of peer relationships and bullying, which is really important, because these may kind of combine with their trauma and create even further trauma impacts. We want to really work on those emotion regulation skills here, due to the intensity of emotions that occurs towards the end of this period. So around 10 to 12. Their emotional intensity really increases. And if they don't regulate well, there's usually some difficulties. There can be very emotional. So it's really important to increase those emotion regulation skills and help support them to develop those through, of course, attunement, co-regulation, and felt safety. So now we come to adolescence, which is 12, 13 on. So teenagers are dealing with difficult developmental tasks. They're really, really difficult, and they're even more complicated when there has been difficulties or disruptions in attachment and a lack of felt safety. So, adolescence is an amazing time of brain development. Adults would be healthier if we harnessed these brain states in these developmental areas because they're really good for your brain. And this comes from Daniel Siegel in Brainstorm. He talks about how they're emotionally sparked. So they get excited about things really quick. And that's where you'll hear, oh my gosh, that's my favorite song, turn it up. And they'll get excited about things, and they'll be just there. The whole world is an opportunity for them at this age, and they really get excited about it. They also turn more towards social engagement in peers. So they want to be with their friends. They're developing identity that's kind of along with their friends or by their friend group. And they also like new things. They like creative new things that they maybe haven't experienced. So they'll seek out new experiences. They'll try a lot of different things, and they move on relatively quickly. And there's also a lot of creative expression. So this is where you'll see changes in hair, makeup, fashion. You'll see a lot of expression through music. So this is all really good, healthy brain development, and we really want to support those areas for healthy development. The problem is, this is also an extremely vulnerable time due to these developmental demands that are separating from adults, identifying who they are, so their identity development, and peer orientation with a peer group that may or may not be a very healthy peer group. So complicated attachment histories create greater difficulties for these adolescents to navigate through these developmental tasks. And this is where you can see a child that has been like this great, quiet, well-behaved kid, but had a lot of complications. All of a sudden, when they hit about 13, they're off the rails, and it's like they're a completely different kid. It's because the neural pathways that were laid down from 0 to 12, everything that wasn't used is peeled back, and everything that was is accelerated. So that's where we see that vulnerability. So they're at higher risk for mental health difficulties like anxiety and depression, self-harm, suicidal ideation. This is why those things become so prevalent in teenagers. It's this developmental stage that they're tasked with that can be really complicated, particularly if they've had attachment disruptions. So they can end up developing self-destructive coping skills. So you'll see this in substance use, crime, kind of peer relationships, or depending on relationships really strongly, which is kind of outside the developmental norm for their age. So without these experience of felt safety in childhood before adolescent development, they may experience safety with risky, dangerous people that they can contort their neuroception. So this is where you get gang involvement, crime, trafficking, because people don't approach you and say, this is what we're going to do. In the end, they groom up front, right? So it's a very different type of grooming, but this is where they're very vulnerable because they're looking for that identity development. They're looking to try to separate from parents, but they're not capable of living on their own. So this is where they may gravitate towards very risky, unhealthy things. And they're much greater risk if they've had a history of grooming in childhood. So their neuroception has become contorted, and grooming has made that a familiar experience. So this is a really important part of working with teens and with kids, is to look for those experiences where their neuroception may have been used against them and help them feel safe in really unsafe situations. Another thing we'll see is higher use of substances, self-harm, criminal behavior, because it elevates mood and it can kind of give you a false sense of regulation. So I've had numerous clients, teenagers, who've stolen cars. And they're usually kind of numbed out, really quiet. They talk really soft. And then when you ask them about when they stole that car, oh my gosh, I felt so alive. And they'll just perk up. They'll tell you all about it. They were regulating their nervous system in a very, very unhealthy way. So they may have those experiences. They may need to numb emotional wounds. So you'll see use of substances that kind of numb, like marijuana, alcohol. So they numb out their emotions because they're a lot to deal with in this developmental phase. So experiences of felt safety with adolescents, these are critical to support them through this phase of life. We need them to be seeking out safe adults for guidance. That's sometimes where therapy really comes in, is it's a person that isn't in opposition with family, with school, but it's a person who is there for you, that can really support that development and give that felt sense of safety. But they need to have aunties, family, friends, people that are safe people that can give them guidance and that sense of felt safety. We also want to help support accurate neuroception. We don't want them feeling like high risk things help you feel alive, because it's going to lead to a lot of difficulties and even more trauma and damage for them. And we want them to experience co-regulation so that they get better self-regulation skills. So there you have it. That is felt safety for children and adolescents. This is a big concept, and it's a very important one for us to really be able to master and support our clients with. So we've talked about understanding felt safety, foundations to foster felt safety, strategies to enhance felt safety, and those special considerations related to developmental stages. So if you are a therapist that is interested in applying these concepts, the first place to start would be at the 5domainschecklist.com. That is the checklist that has all the things you need to be watching out for when you're working with complex families, including the impacts on therapy, difficulties with co-regulation, parenting strategies that backfire, negative mentalization of the child, and the child's negative self-beliefs. And that's all rooted in this felt safety. And that's why it's so important. So I hope you have a great day, and we'll dive deeper into another aspect of developmental trauma next week. Have a beautiful day.